Great pleasure to have Dr. William Au with us today. He's a distinguished professor at the University of Texas Medical Branch, and he is also an honorary professor in different countries like Romania and China and Kazakhstan. He is really an international scientist. He has more than 250 scientific papers in the high impact journals, and also editing in a very respectable journal. He organized several international conferences in different countries. He used to be either head or member of the international committee. His research focused on environmental and public health and the molecular mechanisms relevant to development of cancer, and especially from exposure to toxic substances that can be used to precision disease prevention and personalized intervention applications. I learned a lot from Dr. Au, especially the susceptibility to diseases. He has many ideas and many aspects in this field. We will have the pleasure to have you, Dr. Au, and we are looking forward to a very productive discussion also.
Thank you very much, Professor Anwar. Yeah. Thank you very much. It's my honor to be invited to make presentation to your two societies and to many international scientists who join in this seminar. As you know that Professor Wakil Anwar and I have been collaborating very successfully for more than 30 years. So I look forward to more collaboration with Professor Anwar and with the two societies, because my expertise works well for both societies. So with that in mind, let me start with my presentation. So on the bottom of the presentation is about biomarkers for assessment of population and individual-based health risks. So far, most of health risk assessment for population is based on population, like a group of people, but we are moving towards assessment on individual basis. So So on the bottom of the first slide are two review papers that cover a lot of the top information I present to you today. So keep in mind the two papers, one is in 2022 is in press and one in 2020. So next slide. So let me make a broad statement about the topic of human health. All human diseases have causation from genetic, environment, and both genetic and environmental factors. So understanding these factors for causation of disease is essential for us to treat patients for prevention and intervention of human diseases. So with that broad statement, I would present you my topic for the lecture today. Next slide. So the objective of my presentation are the following: to evaluate human health hazards in population from the exposure to toxic substances. I focus on chemical, environmental chemical, and radioactive agent, as well as medication. So there are many other factors, but these are my specialty. So I will also cover the topic that we are assessing human health from the population basis to individual basis. Because as Professor Wakil Anwar mentioned, there are susceptibility in the population that cause some people to be more sensitive and others to be more resistant to induction of diseases. So we need to go from population to individual basis. So using the individual data generated from investigation, we can conduct precise disease prevention and intervention, such as treatment of patients. Now, so how do we know that certain diseases are caused by genetic factors, right? So you look at the data, you know, these kind of diseases are familial, like from family to family in generation. They happen more frequently in twins. You can identify defective genes. You can make a prediction of how it is transmitted from one generation to another. So these are the key for identification that certain diseases are based on genetic causation. Okay, next slide. So this is like a chromosome. Number 7, certain genes have already mapped onto chromosome and identified to be causation of human diseases. For example, this CF is a gene located in the long arm of chromosome 7. This defective gene is a major cause for cystic fibrosis. There are also other genes that cause metabolic changes that affect the development of disease. So these are genetic factors. You can identify it, you know the defect, you know what kind of disease they can cause, and how are they transmitted from one generation to another. Next slide. However, disease pattern in a population changes with time, okay, very slowly. But when you map it across many years, you can clearly see the difference. For example, this early one, 1900. So this the mortality caused by infection, mortality caused by cardiovascular diseases, cancer, and others, like suicide, war, a lot of war that cause death. Now, so in the early stages, the majority of the death were caused by infection. So by the year 1996, even up to now, so they don't change too much. Most of those are very little mortality is caused by infection. Nowadays we have COVID, is very unusual, but it's still under control. All right, but majority of the causation of death is due to cardiovascular diseases and cancer. You see the major changes. So we recognize that it cannot be due to genetic changes, but very obviously environmental changes. Environmental changes is related to we live longer also. We live longer, so we have chronic diseases like the cardiovascular diseases and cancer. We have more exposure to toxic substances and so on. All right. So with that information, we have to change gear into identifying what are the new causes for human diseases, what can we do for prevention and intervention. So next slide. So now then we can focus on environmental factors. So what are the causes, environmental causes for the recent pattern of diseases? Well, you can look at it very clearly. There are the disease pattern among migrants or immigrants are different. The Egyptian in Egypt have a certain pattern of disease. When they migrated to America, they have a different pattern of disease. So they're the same genes, same people. So it's due to the different environment. The diseases are not present in twins. They are not transmissible from one generation to another. And environmental factors are mainly caused by late stage of onset. That's why we have, when we live longer, we have cardiovascular diseases and cancer. They become much more frequent than years ago. Next slide. So the focus of my work is how to identify environmental factors and mechanism for human diseases. For this, we need to conduct population study. We can do cell culture study and animal study, but to address human diseases more precisely is necessary to do population study also. Next slide. All right, why do we do population study? All right, there's some more real reason for that. To understand effect from realistic exposure condition and human exposure. Right? So we're exposed realistically on a daily basis to toxic substances in the environment. It's difficult to reproduce them in a laboratory. We determine effect in heterogeneous population, different country, old and young people, male and female. And we can understand influence from genetic and other factors, right? We have genetic background, and what are the other factors that cause the disease? Environmental factor as well as social and behavioral. They are the important factor as well. Well, we can follow up to do disease development process. Well, for some cancer take about 20 years to develop. So we need to know what are the different stages for the cancer cell to evolve and become cancer and eventually cause metastasis and mortality. So disease development process is important to know because you can intervene the process to stop the disease. So having all that information, we can do precise prevention and intervention. Now, but for population study, there are challenges. The challenges are much more complex than that in cell culture work or animal study. Oh, because population are exposed to toxic substances in a realistic manner. So in human population, the concurrent exposure to multiple toxic substances, environmental pollution, automobile exhaust, cigarette smoking, and so on. So multiple. So it becomes a challenge to identify which is more important in the causation of disease. Also in human population, we expose to different concentration of toxic substances on a daily basis, from low to high, a variant, sometimes low, sometimes high. Right? So you can be exposed for a long time, 10 years, 20 years, or intermittent. We can be exposed to previous toxic substances. If we work in different places, we may be exposed to different toxic substances at work. Somebody who smoked and quit smoking now, so they were previous smokers. So we need to consider these factors when we do the study to identify causation and development of disease. These need to be considered, right? So, and consideration will affect our experimental design. How do we design the study to identify the key factor for our investigation? Now, let's look at the exposure then. When we're exposed to toxic substances, first of all, the toxin had to be taken inside the body and distributed. Right? The intake can be orally or by inhalation or by skin absorption. So after the intake and distribution, the chemical, particularly in particular chemical, become metabolized. They can be activated or detoxified and distribute within the body, become biologically available inside the body. Right? Many of substances may persist in the body and accumulate. Some of them are excreted and will cause no harm to the body. So what kind of cell type should we use to identify the persistent accumulation of these substances? Lymphocyte will be a good one because they're easy to collect. They live for many years and will accumulate all the information inside the body of a human being. Right? So inside the cell and inside the body, these chemical or toxic substances interact with macromolecule, DNA, RNA, with cell, tissue, and organ. So we are the one to find out what are the interaction, what are the effects from that exposure, right? So what are the cellular tissue and organ responses? What are the consequences from that exposure? So you can imagine, so it's very exciting to do this kind of study. You can do pieces of that, or you can do the whole process